Okay, this video is a book review, and this is the book. It's called Stopping Kidney Disease. Here is the author, Lee Hull. I'll show you a picture of the author right here. That's him, Lee Hull. He's a smart guy, very smart guy actually. He is a patient who himself was in kidney failure, and he was headed towards dialysis, and he decided to try to do everything he could to stop the disease. Now, this book is a big book. It's about 525 pages, so it's kind of a big monster. You see, I've read this book cover to cover a couple times, and I would tell you, like, I recently did a review of a book by Jennifer Moore called Plant-Fed Kidneys. That's a better book to start for a regular person. That book is, I don't remember, not even 100 pages. It's very easy to read. It tells you the key points. Reduce your protein intake. Eat 100% plant-based diet. That's what you need to know. This book is more like an obsessive-compulsive, very intelligent person, leaving no stone unturned to go through all the kidney papers, and you're going to end up in the same place. Eat 100% vegan. As low protein as possible. You might need to supplement with the analogs or essential amino acids, but it's a good, thorough book for the person who wants to read about all the details. He goes through all these charts of acid-based load on foods and stuff. I'll just summarize some of the things that I found were interesting in it. But again, read Plant-Fed Kidneys first if somebody in your family has kidney failure, and then let them read this one later. Most patients, I don't think, intellectually can handle this book. It's too complicated, but it is a good book. Okay, so what are just some of the things that Lee Hull says? Quality of life decreases with each worsening stage of kidney decline. It's the road to hell. Yeah, kind of like Dante heading towards the inferno. For those who go on dialysis, the one-year mortality is about 25%. This is worse than most cancers, okay? Patients die fast. Predictors of mortality, the basic predictors of kidney function, glomerular filtration rate, proteinuria, but also all their comorbidity. Do they have elevated cholesterol, hypertension, diabetes, autoimmune disease? What's their overall nutrition level, blood albumin levels? Are they smokers, drinkers? Okay, so you want to get rid of all your comorbid conditions. What's the way to do that? Low-fat, low-sodium vegan diet to get rid of diabetes and hypertension and obesity if possible. You can control your protein intake, the acid intake in your food, the available phosphate content, fiber, antioxidants. So the point he makes is, again, like my internal medicine friend said, he said, patients don't realize they have the power. Their health is in their own hands, not their doctor, by what they eat, how they sleep, how they exercise. Okay, he was lucky enough to meet Dr. Mackenzie Walser at Johns Hopkins. He was sort of a pioneer of dietary therapy for kidney failure over at Johns Hopkins, let's say around 2000. So he learned a lot from Walser, but he came to the conclusion that Walser was being too wimpy, which is a common problem with conventional medical doctors, that you need to be more aggressive with this protein reduction and with being 100% vegan, not just plant-based. You need to be 100% vegan, okay? And then he read Esselson's book about, saving the arteries in the heart, and he realized the more extreme the diet towards low-fat vegan, the better the patient got. So he started pushing in that direction and studying the difference between plant-based diets and animal food diets. He didn't come to it naturally. Animal food diets, animal protein is very acidic, and it causes something called hypofiltration in the glomerulus, whereby you increase the pressure within the glomerulus, the filtration unit of the kidney, and over time that damages the glomerulus. It's like making it work a triple shift, okay? So again, this idea of overactivating a tissue is a common one. I commonly speak about that in the brain, okay? And that's what's being done to the kidney, okay? He says there's a lot of things that accelerate aging. If you overactivate mTOR, if you have an excessive amount of advanced glycation end products, if you have a high blood cholesterol, if you have chronic metabolic acidosis, eating high-fat diets, eating high-protein diets. These are all things that accelerate aging. You don't want these things. Okay, excessive dietary sodium, excessive estrogenic chemicals, heavy metal toxicities. Okay, mitochondria inhibitors, circuit inhibitors. Okay, albumin is about 50% of your blood plasma proteins. It has a half-life of 20 days. It's made in the liver. Normal blood level of albumin is kind of similar to potassium, from 3.5 to 5.5. Ideally, you want to try to keep it over 4. Even better, you keep it over 4.5. Albumin's weight is about 69 kilodaltons. Glomerular basement membrane normally blocks the filtration of albumin. Some sneaks through and the tubules resorb it typically. If you've got a small amount of albumin in the urine, microalbuminuria of 30 milligrams in one day, that's bad. But macroalbuminuria, tenfold higher, that's even worse. Okay. About 300 milligrams per 24 hours. Nephrotic syndrome is even worse, another order of magnitude greater. One of the most common causes comes from something called focal segmental glomerulosclerosis. The stages of kidney failure are stage 1 is like greater than 90, 2 is 60. The way you can remember, most importantly, is stage 3. Stage 3 is stage 3, number 3, and then 30 to 60. That's the key to remember, okay? And that's when people are really considered in trouble. Once they go to 4, then they're like a hop, skip, and a jump away from dialysis. Dialysis is usually when they get a GFR down to about 10 or 15. Okay, and once they go on dialysis, they often die pretty soon. Some of them live a long time, but many of them are dead within 1 year. At least half of them are dead within 5 years, maybe 3 years. Okay, you can call it stage 5D for dialysis. Let's see, what else is interesting? Albumin does a lot of things in the blood. First of all, interesting thing about it, it has a negative charge on it, so it has a zeta potential of its own in a sense. It is important for intravascular oncotic pressure, the osmolality of the blood plasma, to keep the water in the blood and not going extravascular. It'll transport other things like fatty acids. Let's see. When your albumin is going up in your kidney failure patient, that's a good thing. If your albumin is going down in your kidney failure patient, that's a bad thing. Suggests you're leaking it. You're losing it out of the kidneys because your filtration barrier is broken. Phetuin A is a protein made in the liver that helps prevent vascular calcification. When you're leaking albumin in the urine, you're often leaking Phetuin A, and that prevents vascular calcification. So once it's gone, kidney failure patients typically calcify all their vessels. Like if you look at their head CT, plain film of their head from across the room, you can see calcifications all over the external carotid artery branches that outline the skull. It's a big disaster. I can just look at a film from across the room and say, that's a kidney failure patient. It's bad. That's why they die so soon. They mostly die of heart disease. That's another reason why they should be on something like the Esselstyn diet. They're probably going to die from heart disease, so why not put them on the Esselstyn diet? Because usually the sad truth is there's a fundamental conflict of interest between conventional medicine and patient care for chronic disease. They make a lot more money once the patient's on dialysis. So most nephrologists don't know anything about nutrition. Most of them don't provide any care to these patients while they're crashing and burning until they hit dialysis, okay? It's a very small percentage that actually see a renal dietitian before dialysis that helps guide them through a low-protein diet. And what they really should be doing is dramatically lowering their dietary protein, going on a very low-protein diet. I'll show you the numbers. I think they're on the next page. Normal blood pH is about 7.35 to 7.45. Animal foods tend to be very high in acid because of the methionine, the sulfur-containing amino acid that's partially degraded to sulfuric acid. So they should not eat even one bite of animal food. People talk about treating them with sodium bicarb, but the problem with treating with sodium bicarb, baking soda, is that it's got sodium in it, which will raise blood pressure and that can damage the kidney. Fruits and vegetables are surprisingly good. They're very alkaline, they're low in protein, low in sodium, high in potassium. Okay, some people at the end of the line, they start having trouble with potassium, but potassium as a concern is overrated. Okay, the same things that are high protein tend to be high acid, especially all your meats and stuff, and they worsen kidney function. You also have creatine and creatinine in animal foods that increase the protein load. Well, I don't think I had all my info. I did his other book too. He had another more recent book where he specifically went through the very low protein diets and keto analogs. So you can just search under his name, Lee Hull. It's like Bobby Hull, and you'll find that one. GFR of 60 is a tipping point where people can't handle animal protein anymore. So if their GFR dips below 60, they should never have another bite of animal protein. We talk about nephrotic syndrome is, again, order of magnitude greater than that, 3 grams per day. Let's see. Once you're diagnosed with kidney disease, no more animal protein. Stress increases the risk of kidney disease. Yeah, because it increases the risk of diabetes and hypertension. In a sense, what you're doing is you're using your brain to choose the optimal diet so you can reduce the workload of your kidneys, and that protects the kidneys. It slows their decline. I think that's about it. Let's see, maybe I got one more page here. Oh yeah, I got one more page on it. Okay, calcium supplements increase your risk of death. Yeah, that's a bad idea. They're often hypercalcemic to begin with, and hypercalcemia, when people have got their calcium supplements over 1,400 grams, just like in women worried about osteoporosis, they had a 2.6 times increased risk of cardiovascular death. I think it transiently boluses the plasma and functions like a clotting protein. It's a clotting protein, and they get a transient hypercoagulability that can give them an MI. Okay, methionine is much lower in vegans than it is in meat eaters. So in a sense, you automatically methionine restrict when you eat a low-fat vegan diet, low-protein vegan diet, and that, in animal studies, suggests increased longevity. Maybe that's why they tend to live longer. That's one of the reasons. Okay, dietary protein in grams for an average man, 75 kilogram in weight, is about 1.2 grams per kilogram. Ends up being 90 grams per day. What is recommended by the RDA, recommended daily allowance, is 0.8 grams per kilogram per day. That ends you up at about 60 grams a day. Low protein diets, 0.6 grams per kilogram per day. That ends up an average sized man at about 45 grams per day. A very low protein diet, 0.3 grams per kilogram per day. That ends you up at 22.5 grams per day about. So that's a dramatic reduction in protein intake. That's about 1/4 of what the typical person's eating. And again, the goal is to reduce the workload of the kidneys as much as possible, but still get adequate nutrients for the body. Okay, oops, sorry about that. Trying to move myself here. Exercise is good for CKD patients. They live longer. And he jokingly says it's true. USA is a third world country when it comes to CKD outcomes because they don't know nutrition, and that's the most important thing. They don't know toxicology either, and they don't know leaky gut. All of that stuff's real important for kidney function. And he says, imagine a heart disease patient being told to wait until they have a heart attack, then come back for treatment. It's ridiculous telling the patients that you can't do anything for them until they are on dialysis. So he says your goal of treatment should be to aggressively treat your kidney disease from day number 1 that you learn about it, and never stop trying to slow down or stop the progression of kidney disease. Try to cure all of your comorbid conditions like obesity, diabetes, hypertension, and what. So anyways, I think it's a very good book. It's kind of long-winded. He's not a medical person, and he would sometimes take 5 pages to say what you can say on 1 page, but it's still good. His heart's in the right place. He's really trying, and he went through a ton of information. So that'll sort of iron out some of the details if you're interested in that. So anyways, it's interesting.